So we will start by presenting Inspire. This is the programme that, we've been working on for a few years now. I'm going to ask Sharma to share the presentation, so we'll talk you through where we're at. Are you able to put it on slideshow, Sharma, just so that we can see the full? Brilliant, lovely. And just to go to the first slide. Thank you. The next one, please. I don't know if you're having Brilliant, lovely, thank you. So the programme is basically, we're going to kind of talk through today who's involved, sort of who's kind of sponsoring, which is LEP, the Legacy Health Partnership, the background and context of the programme, what our aims are. We had a launch last year of the London-wide programme, Khan's involvement, and we've got Charles with us today, the steering group, and what the activities have been. And I think partly, if you look at those two bubbles on your right, the biggest sort of driver for us was always just around people feeling that they weren't part of the system. So I think we had this young person of 19 saying the system was just not for them, and I think that was always a massive motivator in how do we change that, so people feel that there are the system is accessible for everybody. Next slide, please. These are our partners. These are the people who've been heavily involved and we've worked very closely with. So the UK Health Security Agency, OHID, the Office of for Health Improvement and Disparities, ADPH, which is Directors of Public Health, Greater London Authority, NHS and London councils. We have also worked with lots of voluntary sector groups as well. Next slide, please. So just, I guess, going back to the impact of COVID, which I guess was the massive, another, massive driver behind this. I think what's really important to say that, we're really clear that these inequalities existed before COVID. COVID didn't, create them, but it absolutely was a point where they became so much more transparent for everyone to see. And if you look at some of that data, so, the highest cumulative COVID-19 hospital admissions were in the Black community, at 2.5, around 2.5 to 3 times higher risk of dying of COVID. They're massive numbers, and I think that they really highlighted some of the issues. I think you can see that just from that data, and if you look across, you can see the other data. It's just really, really worrying. But I think, like I say, this was just, I guess this talks about COVID, but it was really just highlighting that was just replicated through other health conditions as well in a massive way. Next slide, please. So I think if you look at some of these, and we've got some more kind of snapshots of some of the other areas where there's massive disparities. But maternity, I think lots of you will have heard through the media and lots of other spaces, for maternity, kind of the risks for Black women compared to their white counterparts is massive. I think cancer in the Black community, Black British women are more likely to be diagnosed in it, and that in itself again is it's really high. And I think that it's not just around women and breast cancer and other cancers. When we look at men and prostate cancer, that's equally replicated. Obesity is a massive issue. If you look at some of the data here that we've got, where in some communities it's starting to reduce, it's not the case in the Black community. I think heart conditions, really concerning, and the same with diabetes, so 3 times higher in the mortality rate of people with diabetes in the Black community. And just to be clear, when we're talking about the Black community, it is the Black African and Caribbean community that we're referring to. Next slide, please. So after, I guess, the starkness of COVID, the Legacy and Health Equity Partnership was set up to really start to look at the system, and how do we change some of those systems in terms of getting some equity. That the LEP is now actually coming to an end. There will be a legacy, and Inspire will be part of that legacy. But this was some of the clear aims and objectives of the LEP. So communities first. So really being driven by what communities needed. So, you know, unlike I think often what can happen in big systems, especially around health, it can be very dictated to what the system needs. I think LEP was very much set up to how do you really go from what does the community need? Building trust. I think we talk about trust an awful lot when we're talking about health inequalities in the Black community, but this was really fundamentally about how do we change that narrative and how do we start to talk to people about what do we need to do differently. And then system leadership. So how do we change the system? How do we start really looking at how we deliver in a way that starts to be far more inclusive? Next slide, please. So these are some of the programs that the LEP worked on, and you'll see they're kind of, again, you know, hyperlocal communities really doing things at place and looking at best practice, being community led. So, you know, looking at what does the community need, some work around the health and faith networks. So there's some networks that were also set up that are becoming really strong in this space, and how are they connected into the system to start to do things differently. There was ambassadors and champions, communities of practice and projects for health resilience, that again were kind of looking at different age groups, trying to look at younger people. So really looking at that, how they influence families often, and how if actually we start to do a lot more work with our younger groups, we could really influence how they felt about the health system, and that would impact families, because often that's what happens. Vaccines and screening, again, massive. I think one of the things I think lots of us learned at the beginning of COVID and the vaccines was about how do we do that in a way that doesn't become really focused on a space that some people don't want it to be. So, you know, there was lots of narrative around, we talked to people about vaccines, and actually they were much more concerned about the housing or other issues. And what we need to do is be led by what the community wanted, not the agenda of kind of health screening and vaccines, but what was really relevant to individuals at the time. Thank you. Next slide, please. So this is just the people who've been involved in the Legacy Health Partnership, but also just the wider stakeholders. I mean, we can send this out to you afterwards if that's helpful. So really just looking at the breadth of people who are involved and the kind of partnerships that were made during this period and are still really kind of, you know, solid and kind of working across that system. Next slide, please. So back to how we started with Inspire. So Inspire actually started in 21, and it started off just as a kind of single event in Lambeth where some partners came together. So NHS, UXA, OHID and GLA. So we looked at the acronyms earlier, but that's the UK Health Security Agency, the Office of Health Disparities and the GLA. And really we were just looking at what could we do locally that would really start to engage with our Black community around these health inequalities. There was a massive event in 2021 during Black History Month where we had 500 people attend, lots of different health checks, but also voluntary sector groups, lots of nice food, lots of good music. It was a real success. But what we really learned from that was there was also lots of things that happened where people were having early diagnosis and getting screened and then went off to find out so much more about their health. So a real success. And then we kind of, from that, started to realise that actually there were other boroughs who needed to look at this in a slightly different way. So the 8 borough work happened across the 8 boroughs with the lowest uptake of the COVID vaccine. Now, although that was the barometer for the boroughs getting involved, I think very quickly we learned that it was, again, so much bigger than that and so much more around trust. So each of the 8 boroughs worked with a local organisation to have events, a run of events to really engage with communities on their terms, on what they wanted to happen locally to address some of the issues. Really successful programme. We had lots of events. And then that led us to last year. That work ended in March 23. And then we kind of started to look at what next. So then we went on to thinking about actually how do we roll this out across London and think about it in a much broader way. So I was asked to co-chair with Sedi Frederick, who is my co-chair, who unfortunately can't be here today. But we then worked with Charles, who is here today, from the Caribbean and African Health Network, to really look at implementing this work. Next slide, please. So we had a launch last year in July. It was really well attended. It was, really positive. And that's when we started really formally the programme for this year. And we now have a steering group that we'll talk a bit about later, but I'm now going to hand you over to Charles, who's going to tell you a bit about CARN and the massive amount of work they do, both in Manchester, but also in London. So I'm going to hand over to you, Charles.
Yeah, thanks, Juliet. So thanks, colleagues, for your time. So a bit about CARN, the Caribbean African Health Network, or CARN for short. We were set up in 2017 in Greater Manchester. It was on the back of a PhD research that was looking at why Black people tend to have poorer cardiovascular outcomes. And during the focus group discussions, people were asking what was going to happen to the data. So lo and behold, 10 people came together, set up as a CIC. And that's what we are at the moment. So for some of you who have been following the health and social care, reorganization, then Greater Manchester had the devolved health and social care budget back end of 2016. So a bit ahead of the current ICSs. Our vision really is ending health inequalities and wider disparities for Caribbean African people within a generation. And the mission really is to ensure that both strategic and operational actions, lead to racial and social justice for Black people. Next slide, please. Yeah, I mean, Juliet touched on some of the disparities earlier on, and for us as an organization, this is a driving motivation, and how desperate we are to really make a difference in our community. And so, you can see the data on there. Pre-pandemic, people weren't very much interested in health inequalities. So whilst, there were awareness data coming out during the pandemic saying Black people twice more likely to die from COVID, you can see we're 5 times more likely to develop kidney failure, 3 times more likely for type 2 diabetes, and obesity rates are high, 4 times more hypertension. So it goes on and on. And so this thing we say is COVID didn't teach us anything new. It just helped give us a seat around the table. Next slide, please.
Charles, can I just stop there and just ask people, does that slide surprise them? Just because we're quite a small group. So I just wondered if people wanted to, because I think that slide for me is always a really powerful slide, but it would be just good to get any thoughts about whether people are shocked about those numbers or whether they kind of knew them. I don't know if anyone wants to say anything.
Let me just unmute everybody quickly.
Rather than just talking at you, it'd be good to kind of know your thoughts.
Oh, thank you. This is really great, and it's really great what Sharma and the team are doing. I think some of them are not surprising, but others are. I think in terms of definitely knew about the Mental Health Act. We know that, with adults, particularly Black males, more likely. We know I've got brothers, I've got family members who we can see in terms of prisons. We know they come out with diagnosis and they're likely to be more likely to be sectioned. I think that there are definitely sometimes diabetes. That's an issue that we hear about. So I think there is something around prevention that we know, and we are told about. In the Black community, we need to do more of this, and we're more prone or more likely. But there is others here that are, 3 times more likely to be overweight. I mean, that's surprising, particularly in thinking about obesity and knowing it, I suppose in terms of the disproportionate number numbers of the Black, African, Caribbean communities in there, and that links to poverty. You know, there's links around poverty and stuff. So I think there are some things for me that are surprising, and some things it's just wow, we need to be talking about this more. You know, we need to be raising the profile of this more. It affects all of us, you know, and I think there's something about education, but there's something about awareness, and it's stark, really, some of the figures.
And I think you're right, Jennifer. There is something about, so I think that one of the things that we always talk about a lot in this program is there are all these. One, there's the wider social determinants of health, so all the kind of housing, education that have an impact, but also that it's really hard to see these in isolation without looking at the system. So, you know, when you're talking about Black men, you know, so I was I worked in mental health for a long time as a social worker, and actually we know there's a massive overrepresentation, but that's not just about Black men, that's about a system that isn't able to support our Black men. Do you know what I mean? Or about their history and legacy of living as Black men in their communities. So I think there is something about there are these, and this slide for me is also a really good slide to look at, really hard hitting, because it actually really just summarizes what the challenge is.
And I think you're right. I think it's about the sort of the whole ecosystem that we fall into. So you can't just see it as you said, as there's not just one narrative. It's what's the contextual issues behind all of this, and it plays into a lot of the things that we've been talking about, the structural inequalities that prevail. So no, this is really interesting. Thank you.
Thanks, Jennifer. Did anyone else have any other comments they wanted to make, or just observations in terms of whether this information was kind of new to them or they were very familiar with it? Any other thoughts? Someone just take their mic off.
Yeah, can you see me there?
Yeah,
Juliet. Hi. Yeah, just to say that you know, the kind of the disproportionate rates of people dying during COVID is what made us start looking at this, and then seeing all this underneath and realizing, oh, all this was all there before. I think you know, is it, isn't it? We had, you know, and really, I just want to put this on a big poster up in the corridor, and just so that people can see it and say, like, this is what's going on. But as Jennifer said, like, you have to understand the context as well, because otherwise people kind of will attribute it and just say, well, it's genetic. But actually, there's so many things happening that lead to this, and unless we start talking about all of the different things that are happening, that then, you know, it doesn't mean anything on its own, and we need to kind of start understanding what are some of the things we need to be doing differently.
And I think, Sharma, that point about, and I know, Charles, you referred to this, is it's, you know, COVID didn't create this. It just kind of, it almost, I think for some of us, I was always kind of aware of this in my space, but I think, but not everyone is, you know, because actually we are working in different spaces, and this kind of almost unveiled, you know, COVID unveiled all of this for people to be really hit around the head with it. And it's like, no one can ignore it now, because it's so prominent and evident that we have to do something different.
So yeah, thank you so much, and I'll let Charles carry on.
Yeah, go on. Sorry, Charles. I just thought it'd be good to just check out with people.
Yeah. No, thanks, Juliet, and thanks for the various contributions. So yes, definitely there are structural issues that have contributed to this, and you know, that needs tackling, because if we don't deal with some of those prevention and, you know, awareness raising and working and co-producing, co-designing services that are fit for purpose for communities, then, you know, the burden on the health budget will keep escalating. Next slide, please. Yeah, so Juliet mentioned, obviously we starting Greater Manchester, but in order to deliver the London, you know, Inspire program, we looked at Census 2021 data, so we have a bit of intel in relation to where, you know, Black people live, and I'm sure you could see that, you know, from, you know, the data. But Croydon, Lewisham, Lambeth, Southwark, you know, more densely populated, and some of the sort of innovative and creativity we've been exploring is how what is happening in there and whether they are learning that could be shared, because Inspire covers the 32 boroughs of London. Next slide, please. Yeah, so Juliet mentioned, you can see the steering group. This was our sort of first away day back in October last year, and then also spending some time celebrating Black History Month. But the first session was for steering group and the co-chairs and the delivery team, sort of exploring the program, how far we've come, but then also planning ahead. And then in the afternoon, we had colleagues from the various ICSs, as well as OXA, OHED, and public health teams joining us. Next slide, please. Yeah, so in the first year of the program, which comes to an end in March, and we exploring sort of year two, we focused on 6 key objectives. One is health awareness raising, and for us really it's always about what are the things we can do if money, if there was no money, we can still raise awareness, although there's a cost implication for doing that. So what we've been seeking to do is look at regular health webinars that were happening across our community and encouraging people to attend. So for example, we have our Saturday morning health hour sessions every Saturday morning, 50 weeks in a year, looking at different health conditions. And then on Tuesday evenings, it will be on nutrition and physical activity. So we've been promoting what has been happening with our, through our organization, but then also other Black-led organizations. Once again, at various community events, we know there are festivals, there are, fun days, but for us, it's engaging and, asking the organizers whether we can have some nurses or doctors there, sort of screening and bring a health slant to things as well. And then there's a bit about shining lights on best practice. We know there are brilliant pockets of, amazing work happening across the 32 boroughs of London and beyond. So how do we, shine a light on some of those so that, other organizations or other boroughs don't need to reinvent the wheel, but they can take a template and then sort of tweak it and implement it locally. We've also been doing some asset mapping, looking at where Black-led organizations interested in health and well-being are based. And that is going on an interactive map on the program website, only because we know sometimes, we as a community, we've been labeled as hard to reach, but we know there's no hard to reach community. Usually is the model of engagement that doesn't work. So if there is visibility about Black-led organizations across the 32 boroughs of London, then the system partners and colleagues wouldn't have any excuse saying, oh, we didn't know where to start from, we don't know who to engage. And then, yes, the website has various resources, about the program and what is happening, and some references to NHS England, materials as well. And then the final bit in the first year, because of sustainability as well as the role of integrated care systems, was to make sure we had them on board, had them on side, and engaging with them to make sure they are aware of the program and how the program could add, value to what they were doing across the 5 ICSs in London. Next slide, please. So yeah, it is just a couple of, pages, from the website. Next one. Yeah, we also have a calendar on the website. So for example, in October, making sure we're showcasing what was happening at across different boroughs. And yeah, just so that once again, people from our community what to go to and how to engage with system as well as with other, Black-led organizations. Next slide, please. Yeah, that's the interactive map I talked about. So once again, you could see organizations in alphabetical order. all of them Black-led or, working closely with Black-led communities. Next slide, please. Yeah, so we've done some modeling, looked at co-production, co-design, but once again, how do we get communities to be in the lead and to own some of the conversations and discussions? And the health awareness raising really utilized various social media platforms, as well as, the and like Juliet at the launch, we had, probably, at any one point in time, 145 odd people. So those are on a database and having regular communication with them. And then, yes, really trying also to encourage more Caribbean African clinicians, allied health professionals, to support Black-led organizations. And, one of the things we know Juliet is passionate about in the next year will be communities of practice, but then also making sure we're able to broker, collaborations, partnerships, and looking at different interventions, that Black-led organizations can support. Next slide, please. Yeah, I mean, obviously, just like any program project, there will be challenges. And, historically, there has been limited demographic data. So, sometimes it's felt like starting from scratch, but there's a real motivation to, push on with that. With the ICSs, obviously, the transition from CCGs to ICSs, then, either people, relationships changing and, people finding themselves in new roles or having lost people, then that becomes a challenge. But then also the pressure the system has been, under, whether trying to reorganize, trying to look at national priorities, like urgent and elective waiting lists, and ambulance transfer times and all that. So sometimes, there are people keen to engage, but, national priorities may, what they, and then sort of how do we measure the impact and the difference, the program is making in order to draw, ongoing investment, and then some continuity and sustainability where it's about the resourcing, but how do we move towards multi-year, plan for the program as a whole. Next slide, please. So, Juliet, shall I hand over to you?
Thank you, Charles. Yeah, that's absolutely fine. The learning and recommendations. So I guess the learning has been the importance of robust community engagement. So and I'm sure all of you on the call will kind of understand that in terms of just how are we really working with our communities, being flexible, and being driven by the organisations that are trusted. I think one of the things that we've always been really clear about, but I think, I don't know, COVID seemed to really solidify is that there are absolutely some amazing organisations out there who communities do trust. So we need to work with them to really kind of look at how we work together. Prevention and early detection and self-care being absolutely key. And that whole systems approach again. So really working across the system to understand what the issues are, but also how we can kind of move things forward. Next slide, please. So next year, so phase 2. So as Charles said, this programme at the moment, kind of the first part of the sort of whole London programme, comes to an end at the end of this month. But we have pretty much secured funding for the next year. And I think one of the things we really want to look at is some of these areas. So, community health literacy. So again, continuing with the webinars and really informing and making sure people have everything they need to understand what they need to do. Having a resource hub. So again, looking at community mapping, and some of that will be done through the internet, or the website, sorry. And looking at how we kind of have collaboration tools and learning platforms. Strategic system engagement. As we said earlier, we've done quite a lot of that, but we need to continue doing that, particularly as the LEP is coming to an end. How do we stay engaged with those really big organisations and system leaders to make sure this is continually a focus? And then investment in the Black community. So how do we collaborate with campaigns and do real kind of deep dives locally to know what the issues are? And I think also Charles had mentioned the community of practice, because I think that we really want to look at, because so many people we've spoken to while doing this work have felt quite isolated, especially our Black colleagues, and how do we create a platform where people can feel more connected? Next slide, please. So on Monday, this Monday, we have a Black Health and Equalities Summit that we're all really excited about, but also slightly anxious about, because it's going to be massive. I think we've got an awful lot of people, as you can see. We've got some stalls, we've got, lots of engagement around this. It's going to be held at the Royal Society of Medicine, and then I think we've just got lots of partners who are actually supporting this. And really, it's about a call to action. We want to go from sort of recognition to action. So acknowledging what the issues are, people really understanding what they are, but what are we going to do next? Because we know in this space often we end up we can talk about it. We've got that, slide with all that real stark reality of the impact on the Black community. But the question is, what do we do about it? And I think that this summit is really about how can we get some commitments and some action around addressing some of those issues. Now, we're obviously not going to solve it in one kind of big conference, but I think there is something about having the people in the room who do have the influence to make some changes in those whole systems and do things differently. So that's going to be really exciting on Monday. Exciting and nerve-wracking. But we also just thought today it'd be good to ask you some questions. So we've got a few questions to ask you to just see kind of what you either knew or know about Inspire. So can we go to the next slide? I don't know, Priscilla, if you managed to get the polls launched. Oh, you did. Well
Yeah. So can everyone see that? If you can just give me a
Perfect.
thumbs up. Yeah. Okay, great.
Lovely. So have you heard about the Inspire London programme before today? Sorry, Priscilla, did you want to say something?
Yeah, someone had their hands up.
Did they? Who had their hand up?
Sorry, that was me. I was
Go
meant
on,
to say,
Jennifer.
no, thumbs up. It's meant to be a thumbs
okay.
up. Sorry.
Okay.
I don't know my hands up for me thumbs up. Sorry.
Okay, thank you.
Thanks, Jennifer. So yeah, if you can just put, have you heard about the Inspire programme before? So it'd be really just good to know if anyone had heard about it before we spoke about it today. Let me just look at the chat. It's just the poll. Yeah, has anyone heard about it? Do say if you have or you haven't. It's also good just to talk. Oh.
No, I hadn't heard about it until today.
Okay.
But it was good information.
Brilliant. Okay. Anyone else? Has anyone else heard about it before today? Or has nobody heard about it? Someone got their hand up. Sorry, I've got the poll in front of me. Sharma.
Yeah, I've taken the slides down so we can see each other.
Yeah, good.
I'm coming to your event on Monday, which I'm really looking forward to.
Perfect. Great.
Yeah, it's going to be really exciting.
Had you heard about Inspire though? Is it something you were aware of? No.
No, I had not heard of it till now, until obviously Priscilla found you.
Yeah.
So yeah, really excited and looking forward to working with you more.
One of the things that we've, I think, really picked up is that I think this is probably much more well known in the kind of health spaces. So because it's been driven around health inequalities, and I work across a partnership, a health partnership. So I guess we were kind of involved because of that. But I think for a lot of local authorities, I think this is quite new because it's about, and I'm desperately trying to kind of make sure local authorities are aware of it, because often we're very involved in those wider determinants of health. We may not be directly involved in some of the other health issues, but definitely the wider determinants we are. Jennifer, go for it.
Thank you, Jude. I've got two questions.
Go
So,
on.
first question is, are there any more spaces? Because it says you've got 308 attendance. I clocked that. And the second thing for me was around who's actually attending in terms of local authority representation, because you talked about the 8 London boroughs who you are predominantly working with, and is that right? Or
So that's not
who's
right now.
No,
So that
not
was the last phase of the programme,
right.
where we had
Okay.
the 8 boroughs we were working with, but
Right.
from
Okay.
last year it became
Yeah.
across London.
All right,
So it
across
was a
London.
pan-London.
Okay.
Yeah.
So it's a pan London,
Yeah.
and is that right? In terms of the pan London, are they how far are they working with you? So are some local authorities working with you more closer? Just a bit about that, because I'm in one of those local authorities that you identified right at the bottom of that graph, the
Yes.
grid, that black representation wasn't as high. So I just wondered around that, if you could talk a bit
So-
into that. Thank
So
you.
in terms of who's coming, so your very own Stuart Love is coming on Monday, and he's facilitating a workshop.
Oh, lovely.
I managed to collar in Jennifer to get him to do that. But I think one of the things that's we want to do, which is partly why we're here today, is how do we reach into local authorities? Because I think in the integrated healthcare space, I think Inspire is quite well known now. So with all the public health directors, that's quite well known, with UK Health Security Agency, but I think because parts of local authorities are a part of that integrated bit, but usually only the kind of social care, healthy bit of it, which is a small part of most local authorities. So there's something for me about how do we engage? And so when that piece of work ended in March, that was the 8 borough work.
Yeah.
So that was the 8 boroughs we had listed. And we've become pan London. Partly it is about how do we get into that space. So we're desperately trying to look at that and do that work. So just linking up. But Charles has done some work in Enfield.
Okay.
They've made connections with other boroughs, haven't you, Charles, in terms of this work? So it's yeah. Go on, Charles.
Yeah,
Come in.
and also we're supporting Tower Hamlets. So
Yes.
Juliet was there in January. We had a pre-meet in December because they're looking at setting up an infrastructure umbrella, body for the Caribbean African community. But in terms of the summit, we have good representation from local authority and their public health teams, including Lewisham and Brent, and and then and there will be 20 posters there. Some of them are from local authority as well.
Brilliant. So I'm in Havering. And I kind of do some work so in the voluntary capacity in Havering. Have you got representation from Havering? Is there something I can do in my own local borough? I'm happy to support.
Definitely, there is
Okay,
something you could do.
All right, brilliant.
Let's keep connected about it, Jennifer,
Yeah.
because I think we will do whatever we can to make sure we're reaching out to local authorities or reaching in.
Brilliant. All
So,
right, thank you.
Thanks, Jennifer.
Bye.
Sharma.
I was just reflecting on one of the things that's come up for us in Westminster has been that I guess where the Caribbean communities are more a sort of more established or older community, that a lot of the funding that's been available has tended to be for kind of more arts-based activities, and they're not fitting into sort of, say, refugee type organisations. So in terms of kind of targeting health, we haven't had the kind of organisations with the right kind of fit to be leading that work necessarily. So I'm really interested in where this work will go and helping mobilise some of that work, and also if we've got existing voluntary organisations who'd be interested in getting more involved and like picking that up as part of their work, like how can we then link them in?
Brilliant, Sharma. And I think one of the questions we've got later on is about any black-led organisations that do connect with us, because we'll put them on the website and we'll get kind of engagement, because I think that's key in terms of driving this forward.
Brilliant.
Really conscious of time, so I'm going to go to the next question, and I'm hoping Priscilla's got the poll, which is there anything else you think we need to do to engage local communities, local authorities in this space? So ideas about anything that you think we could do to just get I'm just looking, Is that Brendan? I'm the director of the new Institute of Health Urban Living in Westminster City. We'd be very interested in supporting research. Okay, brilliant. Connect with us. Really interesting. But yeah, anything else that you think we could do to engage with local authorities? Just to also say, Asha's here, who supports the programme, who's also from Lambeth, who is from a local authority, like me. And just, yeah, so if there's anything that you also think, do connect with Asha, because she supports the programme as well. Any other thoughts? I can just see, Jennifer, you've written something else, and particularly interested in the work around prostate cancer. Yeah, brilliant. Okay, lovely. So
Can I just say, sorry, I'm not gonna, I don't want to keep on talking, right?
No, it's fine, Jennifer,
but I do know of someone who does around, you're probably already using it, prostate cancer, really, really great. He's got a bus, he travels around on the bus.
Is it Paul?
Yeah, Paul, you know Paul, yeah? All right, you've linked in with him, all right, brilliant.
Do you know what was really interesting though? When we had our second event in Lambeth, because we had a subsequent one in 2022, he came and had a stall, and he's just got this great story of what someone was identified as having prostate cancer at that event, because they then went and got checked out after the advice he gave them. Now that's not great in terms of, obviously we don't want people to have prostate cancer, but great it was diagnosed so early, and it was just from that event that they'd come and spoken to him.
Brilliant, brilliant.
So yeah, really good.
Yeah,
thank you, Jennifer. So I think I'm going to probably jump to the last question, which is, are there any Black-led organisations you're aware of who could benefit from the Inspire programme? So I think the point that you were making, Sharma, about if there are any organisations that you're working with that are Black-led that you think could really benefit from some support or connect with us, or we could get them on the website, please do come back to us, because I think what would be really good, we're trying to make sure that website for each area has a list of organisations that people can contact, but also any events they're having, so that's really clear for everyone to see. So yes, if you do come back to us. I can see someone's put something else in the chat. Priscilla.
That was just me, yeah. So prior to our speakers, I think about nearly 2 weeks ago, 5 times more, were 2 ladies, Tiniko and Chloe. They focus on Black maternal health. So I think it'll be really good to link up with them.
I think we already are, aren't we,
Oh,
Charles?
is it?
Yeah.
Okay, good.
Yeah. But 5 times more in motherhood are having stalls at the summit. They've expressed interest in supporting ongoing work. So yeah.
Oh, great.
Brilliant, thank you, Priscilla. And I can see, Sharma, you've put Dutch Pot in the so we can I think, oh no, it was Jennifer, I'm sorry. You put Dutch Pot in so we can connect with them. So let's follow up on those.
So sorry, and there's another one. We have Aliyah Ali that will be speaking with us next week, and it's called Daddyless Daughters, and her work is around women that are incarcerated or coming out of prison. So, and that's Black-led as well. I'll put it in here.
Can I make a suggestion that you just email us with the list? So just email us with all of them, and we'll pick them up. And then we can kind of connect in with Charles's team to make sure that we get them on the website. We'll connect with them first and get them on the website. Sounds good. And I think our last slide was really just all our sort of contact details, but would it be helpful to just share the slides around, because we're happy for you to, if you want to, for the information, to share those, Priscilla and Sharma.
If you share that with me, then I'm happy to share it to everyone that's attended today.
Brilliant. I think I emailed them to you, so you should have them. But so has anyone got any questions for us? Is there anything anyone else would like to share or ask us? Charles, go on.
Can you hear me?
Yes, go on.
This is Brendan. Yeah, sorry, I'm on my phone, which is why I'm not on very much.
Okay, that's fine.
One of the on your, it is really shocking, your panel of health inequalities, if you like. There's another area that we know about that's really quite shocking, which is the lack of availability of tissues and cells donations in certain communities. It's really stark, the difference. And so, the donations are different and lower, but then the options for those that need tissues or cells for various clinical conditions is also very limited, if you see what I mean.
Yeah. So that kind of, go on, Charles, were you going to come in?
Yeah, so in the last 7 you make an absolutely important point. In the last 7 years or so, some of us across the country have been working with NHS Blood and Transplant to sort of, improve that, because we know, once again, Black people tend to wait longer, or people with sickle cell need the arrow type, blood type. And through the community investment scheme, we're seeing some little changes. But I think where we need to be urgent towards is where we have commissioning, in different tranches, sort of, recognizing that one size doesn't fit all, and therefore let's do things differently. So if you take Sharma's point in relation to the Black Caribbean, community and probably an older population that may have engaged previously, and there have been various amazing pieces of, intervention and short-term projects done, whether using dominoes and all that. But what we know is that may not necessarily be applicable to middle age and sort of the younger cohorts. So then how do you make sure you using the means that people can relate to? So yes, there are still structural issues, and we need to keep banging on doors with the system, else that one size will keep excluding and deepening the disparities that we already are aware of.
And I guess I think one of the things that was just really interesting recently, that I guess is a very small example of just how it's about the system, is we were looking at measles, which is a big issue at the moment in terms of vaccination, and actually trying to get a variety of pictures of how measles looks on Black skins was really difficult, and we did in the end. But actually that makes a huge difference as to whether people engage with things. If you don't see yourself in something, you don't engage with it. So that, I think there's a lot of work that we still need to do in some of those areas, in terms of connecting people, and whether that's donation or just something being a priority for you. I think we all naturally engage with things where we see people who look like us, and that's something we have to keep working at. So I think we've probably covered everything. Unless there's any other questions, I think I hope we've given you enough information to know about Inspire. Go on, Charles.
Juliet, I think there was a question about Monday. We're still chasing up people, looking at drop-off rates. So if there's any interest, by all means, drop us an email, and then hopefully by Thursday, Friday, we can confirm.
Brilliant. Lovely. So I think it was Jennifer you were saying, but if anyone else is interested in coming, then please, drop us an email and we'll see, because we're trying to kind of, make sure we're looking at people who maybe can't attend. But thank you everyone.
Sorry, I had a quick question.
Okay, go on. Yes, Stu.
In terms of one of the slides picked up on the issues surrounding demographic data. So I work within the sport, leisure and active communities along with the leisure centres. And one of the big issues that we have is that we know, of course, the stats are there that people are obese and not using the centres, but it's the problem of getting people to actually declare their ethnicity. Is there any kind of strategies that you've seen that's worked to kind of get more people declaring it, so that then we can have the statistics to back up the funding applications and stuff that we need to put in?
So I think lots of local authorities, we were doing this actually, and I don't know if it was when you were as far back as when you were first involved, Jennifer, but we did a whole thing about thinking about that sort of share, not declare kind of prospect. So getting people to think about it in terms of how, if you share your protected characteristics, you really can shape how services are run and what is delivered. So I think there's something that we're looking at again with that in the Tackling Race and Equality programme, or that we need to look at again. But there's probably some learning from other boroughs that have done this, because I think it is an issue for all local authorities. We have the same issue in Lambeth, I think, probably, in the NHS, I think all big organisations, because I think sometimes people are really suspicious about why we want their data.
Yeah, just to add on to that, I think you're absolutely right, Juliet. And I know there was a paper that through the group that was produced around sharing. We basically we have done some work. We've done a campaign, and it's a particular area that we're looking at as a team to look at some of those points where people can feel safe. I think it's about underpinning all of it, what you're going to do with your data. That's it. But I think it's about, for me, I'm coming from, well, if we get the data, we're doing things around pay equity, leadership. So with that, we need to understand who's in our organisation in order to address some of those broader inequalities. So there is a piece of work that needs to be done, and we are going to be doing some more around that. So I do watch this space as well.
Awesome. Thanks, guys.
Thank you. So should we hand back to you, Priscilla? Thank you for inviting us. If you need anything else, then do give us a shout. And thank you to everyone who attended.
Thank you so much once again. This was definitely insightful, and I guess a lot of people have taken things away